Hi, I'm Dr. Jeffrey McLean, and I'm here today with Dr. Jennifer Milano, Assistant Professor of Neurology at University of Cincinnati and a sleep expert. So I thought I'd just start off by asking you, what does a sleep expert do? What does a sleep doctor do?
Well, what a sleep doctor does is that we evaluate patients in terms of how their sleep is and what their sleep schedule is like, and if they have good quality of sleep or quantity of sleep, and we try to figure out how their sleep may be associated with their functioning during the day. And so people come in, they see us, and we evaluate them, and sometimes we decide whether or not they need a sleep study for further evaluation.
Okay. And so what are some of the most common problems that people come to you for?
To be evaluated for sleep apnea. What sleep apnea is when their airways close up in the middle of the night and can disrupt their sleep and sleep quality, and as a result of that, they can be very sleepy during the day and have problems with concentration. And so that's one common issue. Another issue that we typically see is people who have problems falling asleep or staying asleep, and part of my job is to figure out why.
You mentioned the sleep study. What does that entail for a patient?
Well, what a sleep study is that we try and figure out, first of all, whether or not they're sleeping. Second of all, what their breathing parameters are like, and that's, in order to diagnose sleep apnea, we need to do a sleep study to do that. And sometimes if people are doing any abnormal movements at night, we can do a sleep study in order to perform that as well, or figure that out as well.
Okay. And when people are having trouble falling asleep, that's something you help people with. What are the main treatment options there?
Well, I think one of the first things is to look at people's behaviors. So a lot of times people have problems falling asleep or staying asleep because their behaviors during the day interrupt or interfere with their ability to fall asleep and stay asleep at night. So as an example, what people can do is that they may be drinking caffeine in the late afternoon or early evening, and we know that caffeine directly interferes with the signal to help us fall asleep at night. That's one thing. Another thing is that if people take prolonged naps during the day, what I like to tell people is that if you have a prolonged nap during the day, that can interfere or steal away sleep at night, and so the goal is to try and consolidate all of those.
And what about medications? A lot of people want to know about medications that can help them sleep. How do you make that decision as a sleep expert when a medication is necessary?
Well, I think the first thing is I tell people that their sleep hygiene and their sleep schedule and their sleep habits are the foundation of all sleep. So that's one of the first things that I work on. But sometimes medications are needed, but when they are needed, it's ideal that they are only used for a short-term period of time, no more than 6 months if absolutely necessary.
And another question that I think a lot of people have is, why is sleep so important, or what are some of the problems that come about for people having trouble with sleep over time?
Well, I think when people have problems with sleep, what can happen is that they can have problems with concentration during the day. They can be excessively sleepy, and so they're not going to be able to be productive at work. Over time, if people are sleep deprived, what can happen is that it can be associated with gaining weight, and it can also be associated with heart issues as well. And so that's an important thing to remember. I think the other thing to remember is that sleep is critical in order to make sure that the brain functions well. The brain is the organ that is associated with every single function in our body. And in order for the brain to work well, people need to have good quantity of sleep. And so for adults, that's usually 7 to 9 hours a night, and good quality of sleep. And so the combination of those two things, I tell people, makes them feel like a rock star during the day.
And what do you say to people that say, well, I just can't do 7 to 9 hours of sleep at night. I'm too busy. I don't have enough time. What do you tell those people? Well,
I tell them, it's my job as a sleep physician to educate them in terms of what's important from a sleep standpoint. There are certain things that I can't control. If they decide that they are not going to sleep as much, then it's ultimately their choice. But at the same time, my role is to educate, and that's the main thing that I do. And as long as they understand that 7 to 9 hours of sleep is best for adults and good quality of sleep is also important as well, then I feel like I've done my job.
Well, thank you, Dr. Milano. It's been great speaking with you.
Thank you, Dr. McLean.